Executive Summary, our proposed social media campaign, Breaking the Silence, Hepatitis B Awareness Campaign, aims to raise awareness about hepatitis B, its prevention and management strategies. The campaign targets young adults aged 18, 30, particularly students, as they are often uninformed about this potentially life-threatening disease. By leveraging social media platforms, we intend to disseminate accurate information, dispel myths, and encourage behavior change regarding hepatitis B. Introduction. In the realm of health promotion and education, this campaign's purpose is not only to disseminate information, but to evoke empathy and understanding among our target audience. By sharing stories like those affected by hepatitis B, we aim to humanize the issue and motivate behavior change. Hepatitis B is a viral infection affecting the liver, transmitted through blood or bodily fluids. Despite being preventable with vaccination and manageable with early detection, hepatitis B continues to pose a significant health burden globally. Reviewing literature and data reveals gaps in awareness and prevention efforts, emphasizing the necessity for targeted educational initiatives. Our campaign addresses this gap by providing accessible and culturally relevant information about hepatitis B. Hepatitis refers to inflammation of the liver, and it can be caused by various factors, including viral infections. The most common viral types are hepatitis A, B, and C, each caused by different viruses and having distinct transmission methods, symptoms, and outcomes. Hepatitis A is caused by the hepatitis A virus, HAV, a single-stranded RNA virus. It is typically transmitted via the fecal-oral route, often through consumption of contaminated food or water. Hepatitis A. Transmission, person-to-person. Contact, close personal contact with an infected person can spread hazard, contaminated, food or water. Eating, food or drinking water contaminated with feces from an infected person is a common mode of transmission. Poor sanitation. Areas with inadequate sanitation and hygiene practices are at higher risk. Hepatitis A symptoms. Symptoms usually appear 2-6 weeks after exposure and can include fatigue, nausea and vomiting, abdominal pain, especially near the liver, loss of appetite, low-grade fever, dark urine, joint pain, jaundice, yellowing of the skin and eyes. Course and outcome. Acute infection. Hepatitis. A does not lead to chronic infection. Most people recover fully within a few weeks to months. Prevention. Vaccination is highly effective in preventing hepatitis A. Good hygiene practices, such as hand washing and safe food preparation, are also crucial. Hepatitis B is caused by the hepatitis B virus, HBV, a double-stranded DNA virus. It is transmitted through contact with infectious body fluids. Transmission. Blood, exposure to infected blood through transfusions, sharing needles, or occupational exposure. Sexual contact, unprotected sex with an infected person. Perinatal transmission, from an infected mother to her baby during childbirth. Other body fluids, such as semen and vaginal fluids. Symptoms. Symptoms appear on average 1-4 months after exposure and can include, similar to hepatitis A, fatigue, nausea, abdominal pain, loss of appetite, fever, dark urine, joint pain, and jaundice. Chronic hepatitis. B. Some individuals, especially infants and young children, may develop chronic hepatitis B, which can lead to liver cirrhosis or liver cancer over time. Course and outcome. Acute infection. Many adults recover completely. Chronic infection. About 5-10% of adults and up to 90% of infants can develop chronic hepatitis B. Prevention, vaccination is the primary method of prevention. Safe sex practices and avoiding sharing needles are also important preventive measures. Hepatitis C. Cause. Hepatitis C is caused by the hepatitis C virus, HCV, a single-stranded RNA virus. It is primarily transmitted through blood-to-blood contact. Transmission. Blood, most commonly through sharing needles among drug users, receiving contaminated blood transfusions, before 1992 in many places, and, less commonly, through occupational exposure. Sexual contact, less common but possible through unprotected sex with an infected person. Perinatal transmission, from an infected mother to her baby. Symptoms. Symptoms, if they appear, usually do so 6-7 weeks after exposure and can include, similar to hepatitis A and B, fatigue, nausea, abdominal pain, loss of appetite, dark urine, and jaundice. Chronic hepatitis C. Many people with hepatitis C do not show symptoms until liver damage is advanced. Course and outcome. Acute infection, acute hepatitis. C is often asymptomatic and can lead to chronic infection. Chronic infection. About 75 to 85% of people with acute hepatitis C will develop chronic infection, leading to potential complications like cirrhosis and liver cancer. Treatment. Antiviral medications can cure hepatitis C in most cases, especially with the advent of direct-acting antivirals, DAAs. Prevention. No vaccine is available, so prevention focuses on reducing risk factors, such as not sharing needles and practicing safe sex. Comparative summary. Transmission. Hepatitis A is mainly fecal-oral, while hepatitis B and C are bloodborne. Course. Hepatitis A is acute and self-limiting. Hepatitis B and C can become chronic, with hepatitis C having the highest risk of chronic infection. Prevention. Vaccines are available for hepatitis A and B. For hepatitis C, preventive measures focus on behavior modification and harm reduction. Understanding the differences between these types of hepatitis is crucial for effective prevention, diagnosis, and treatment. Vaccination remains a cornerstone for preventing hepatitis A and B, while ongoing research and public health efforts aim to control and eventually eradicate hepatitis C.